In the previous videos, we have discussed the first three elements of IB or instructional design, namely situational analysis, learning outcomes, and learning activities. So now we will be focusing on the last element, which is student evaluation. This answers the question, how do we know if we have arrived? We have the learning outcomes as our goal and endpoint, and the learning activities as the means to reach these goals. Naturally, the succeeding step is to determine whether we have achieved our goals. Good day to you. I am Dr. Abby Jennifer Tamayo Tolentino. When speaking of evaluation, most of the time it is interchanged with the term assessment. Evaluation and assessment differs in their purpose. The purpose of assessment is to increase quality, while that of evaluation is to judge quality. Evaluation of student learning is determining whether the students have achieved the learning outcomes or not. This decision will be based on the results of assessment, which includes the identification, collection, and analysis of necessary data. Evaluation of student learning is making a decision whether the students can proceed to the next level or whether they can graduate already. To be able to make this decision or judgment, assessment should be done first because this is the process that will identify, collect, and analyze data that will lead to the decision making. But for the purposes of our discussion, we will be using evaluation and assessment interchangeably. Before we discuss the varied methods by which we can assess or evaluate student learning, we will be dealing with important concepts in assessment first. Our outcome for this session is for us to be able to apply the principles of OBE in planning course assessment, design an assessment plan for the assigned course, and integrate assessment concepts in the design of an assessment plan. Similar with educational strategies, there are also trends in assessment. So this diagram represents two ends of a spectrum, where the other end describes the traditional approach to assessment, in which the assessment process is compartmentalized and time-based with no impact, no learner engagement, and no evaluation of the process itself. While on the other end are the emerging trends in assessment, describing assessment as program-focused, outcome-based, and with positive impact to learning, involvement of the learners, and evaluation of the assessment process. A programmatic approach to assessment is decoupling of the collection of evidence about the learner over a period of time. This is in comparison to the traditional approach where the assessment process is compartmentalized and fragmented, and the decisions about a student are based on isolated events or single examinations at one point in time. For example, an assessment process or assessment plan with only preliminary examination, midterms, and final examination. In programmatic assessment, the assessment process is seen as a system or a program as a whole using a deliberate mix of methods to achieve optimal constructive alignment. This approach is very in line with the outcome-based education principles of expanded opportunities, as well as clarity of focus. With programmatic assessment, decisions about the student are made only after sufficient information across several data points have been collected. With assessment being program focused, it also allows students to be more accountable for their own learning and their own assessment. In almost all cases, programmatic assessment is associated with a so-called assessment for learning philosophy. It is also argued that assessment should reflect the real world of medical practice. Concern has been expressed that the traditional assessment process often reflects a curriculum with a theoretical emphasis, hence Ivory Tower. With a real-world approach to assessment, the knowledge, skills, and attitudes necessary for medical practice can be reflected, leading to valid and authentic assessment. Authentic assessment is a key component of an authentic curriculum where the emphasis is on the assessment of the abilities required of a doctor if they are to serve the patients for whom they are responsible. Outcome-based assessment, meanwhile, reflects the move to outcome-based education. One of the principles of OBE, especially when it comes to assessment, is high expectation, where the standards and outcomes achieved are fixed and defined. What is variable in outcome-based assessment is the time in training. Ideally, in OBE, once the outcomes have been achieved, the students can already progress to the next level, so there is technically no time constraints. But remember that one quality of a good outcome is that it is time-bound and realistic, which means that the outcomes can be achieved within the available time for learning. In contrast to this is the time-based traditional approach, in which time in training is fixed while the standard is variable. For example, a training program is set for 1 year. After 1 year, regardless of what the students have learned in the training program, they are considered graduates of the program already. In a time-based assessment, the focus is more on the process than the product, which is the reverse for outcome-based assessment. Assessment is traditionally viewed as a means to make judgment about whether the learners are fit to progress to the next stage. As we have defined earlier, the main purpose of student evaluation is exactly this. But there is an emerging trend of using assessment for learning and assessment as learning. Assessment for learning means using the results of the assessment to guide or redirect the learning process. This is the underlying philosophy of formative assessment, which is conducted during the course to determine how near or far the students are in terms of achieving the learning outcomes. In formative assessment, the purpose is to provide feedback to the learners. Meanwhile, assessment as learning is interweaving learning tasks and assessment in the curriculum. An example of this is the readiness tests embedded in a team-based learning activity. The purpose of this is to use assessment as part of the teaching learning activity. The emergence of philosophy of assessment for learning and as learning leads to the concept of assessment having a powerful positive impact on the student's learning and behavior. It is argued that assessment should also have an impact on teaching which may result in adjustments to the education program. In a traditional approach, assessment is merely used as a tool to make decisions about the students, but the assessment results are not used to influence student learning and behavior, nor they are used to produce adaptive changes to the curriculum. Another trend in medical education is the recognition of students as partners in the learning process and not just as consumers, which should be reflected in the assessment process. This further leads to the introduction of peer and self-assessment, which we will further discuss in the next presentation. In a traditional approach to assessment, the students are dependent on the teachers to tell them when they are adequate, good, or excellent. There is also a trend in assessment placing importance on the quality control of the assessment process. This should include an evaluation as to whether the assessment is valid, reliable, feasible, acceptable to the different stakeholders, and has a positive impact on the learner and on the curriculum. The concepts of validity, reliability, and feasibility, we will further explore that later. These emerging trends in assessment, combined together, can serve as a framework to plan an institution's assessment program based on a number of dimensions. This diagram is actually referred to as the assessment profile, which is formulated by Harden and Lilly in 2018. P is program focused, R real world, O outcome based, F for learning, I impact, L learner engagement, and E evaluation. So that's assessment profile. Assessment profile. So we will be using this framework to plan the assessment program of BPSU College of Medicine. In planning assessment, there are 6 questions that we need to answer about assessment. Why assess the learner? Who should assess the students? What should be assessed? How should the learner be assessed? When and where the learner should be assessed. First, why do we need to assess the learner? What will be the purpose of our assessment? In answering this question, we can simultaneously answer another question among the 6, which is, when should the learner be assessed? If assessment is done before the instruction, this is diagnostic assessment. If during the instruction, it's formative assessment, and if done at the end, then it's summative assessment. Now, different types of evaluation have different purposes. As we mentioned earlier, evaluation is making judgment on whether the students have achieved the learning outcomes or not. With this purpose, assessment is done at the end of the instruction, and this type of evaluation is summative in nature. If the evaluation is done before the instruction, it is for diagnostic purposes or for purpose of determining what the students already know about the topic or content to be taught so that changes can be made to build up on this previous knowledge. And then we have the formative assessments, which again are done during the instruction, the purpose of which is to provide feedback to the learners to redirect their learning process such that the achievement of the outcomes will be fulfilled at the end. These are the purposes that can be served by assessment, which include deciding whether the learner is fit for purpose. Has the learner satisfactorily completed the training program and achieved the standard expected by the public and professional bodies to practice independently as a resident trainee or a specialist in a particular field of medicine? Assessment plays a key role in mastery learning, where it is expected that all learners will achieve the required standard. Another purpose is assessing the student's progress during the education or training program. This is again referring to formative assessment. Enhancing the student's learning by involving them in the assessment process, which refers to the philosophy of assessment for learning and as learning. Another purpose of assessment is grading or ranking the student with the aim of identifying the best quote unquote students among those being assessed. This refers to the norm reference approach to assessment, which related the learner's performance to that of other learning. The use of this approach is applicable when candidates have to be selected for a limited number of posts, or students have to be chosen for admission to a program where only a set number of places are available. Norm reference approach should not be confused with a criterion reference approach, where the learner's achievement is assessed against the expected learning outcomes or a set of criteria. Assessment can also be used to motivate the student because it has a powerful impact on students and is a major factor in driving their learning. Assessment can also provide feedback, this time for the teacher. Now, the teacher can obtain useful information from student assessment. For example, analysis of the student's scores in a multiple choice question examination can reveal where students perform badly, and it may reflect weakness in the program, which then can be addressed. And then the last purpose of assessment is bringing about assessment-led innovations, such as changes in the curriculum, which is closely related to the previously mentioned purpose of assessment. The next question is, who should assess the students? A range of stakeholders can be involved in assessment, including international and national accrediting bodies, professional associations, the school where the student is enrolled, the department or course committee, the individual teacher, other healthcare professionals, the public and the patients, and the students themselves. Next is what should be assessed. Many problems encountered with assessment arise from a failure to adequately consider what is assessed. Assessment drives learning, and what is assessed becomes the learning outcomes. Using learning outcomes to determine what should be assessed and constructively aligning assessment with outcomes result in adequate consideration of what is to be assessed. This is a key feature of OBE. And when it comes to learning outcomes, areas of evaluation can refer to the three domains of learning, which are cognitive, psychomotor, and affective domains. Consideration of these domains of learning can help in constructive alignment because different areas of evaluation require different but appropriate assessment methods. Assessment methods answer the question, how should the learner be assessed? And as emphasized, the decision on what assessment methods to be used should be guided by the learning outcomes. This is the Miller's Pyramid of Assessment, or the Miller's Prism of Clinical Competence. It has four levels: knows and knows how, both referring to the cognition or the knowledge dimension of competence, and then shows and does, which focus on the performance of skills and demonstration of attitudes, or the behavior dimension of competence. As we can see here, different levels of competence require different methods of assessment. Traditional true or false and multiple choice questions can be used to assess knowledge. At the level of knows how, interpretation or application of knowledge can be assessed through case presentations, essays, and extended matching type questions. Shows level is demonstration of learning already. So this can be assessed through simulations or OSCE, objective structured clinical examinations. And then at the highest level, performance is integrated into practice. So the assessment methods used for this include direct observation and other workplace-based assessment. Note that it is only in the DAS triangle that the doctor truly performs, hence workplace-based assessment. So we will discuss these methods in the next presentation, but for now, the emphasis is on the constructive alignment of outcomes and assessment methods. It works the same way with assessment tools. So they should be both aligned with the learning outcomes and of course with the assessment method to be used. In any case, whatever method or tool is going to be used, they should be constructively aligned, valid, reliable, feasible, and with positive impact. So we've discussed constructive alignment. Meanwhile, validity refers to the degree to which correct inferences can be made based on the information obtained from the given data. In other words, assessment methods and tools are valid if they assess or measure what is intended. Doing so ensures that correct inferences can be made. There are different types of validity. Construct validity is the broadest type, as it refers to the degree to which a certain instrument or method describes the theoretically accepted traits or characteristics of a certain concept under study. For example, the outcome to be assessed is correct patient management. For an assessment method or tool to be construct valid, all components of patient management should be assessed, including accurate history, focused and thorough physical examination, correct interpretation of appropriate laboratory and diagnostic tests, correct diagnosis, comprehensive treatment plan with appropriate interventions, effective communication skills, etc. So, madaling sabi, bawat components ng outcomes na assess. That is construct validity. Kaya nga, aligning our outcomes with assessment is called constructive alignment. Aligning learning outcomes with assessment ensures validity of the process. Content validity refers to the adequacy of the number of items to represent each construct. Concurrent validity means that the results obtained with a particular assessment agree with the results from other instruments and methods administered at approximately the same time to measure the same thing. To establish concurrent validity, we have two assessment methods or instruments that measure the same outcomes. If both process yield the same results, if both methods and instruments yield the same results, then they are concurrently valid. So it has the same concept and principle as reliability. Predictive validity means that the assessment results can be used to predict some future behavior. For example, the psychological tests that are used to predict future behaviors of those who take it. Using a test blueprint or table of specifications can establish validity because it maps out the assessment with the outcomes. So any of these can be used. Bloom's taxonomy is specifically used for written examinations, written assessment. Miller's pyramid is for clinical competence, skills, or behavior. CHED's OBE curriculum map can be used for both. So personally, I use Bloom's taxonomy because I typically use test blueprint for written examinations. The first column is the professional areas of competencies. It could also be the topics covered or the course outcomes themselves. So what we are going to put here in the second column up to the second to the last column would be the number of items for each level of learning. So for example, I am planning to have 5 recall questions for Farm 2. So recall, this is recall. Um, Farm 2, so I'll put 5 here. Then I want to have one case analysis for Farm 5. So I'll put that in as well. So case analysis is at the level of analyzing. Farm 5, so one question for that. And so on and so forth until we are able or I am able to address all the learning outcomes. In the last column, I will sum up the number of items for each topic and then have a grand total at the bottom. Similarly, I will sum up the items for each level. So, pag ganito naman siya, yung kanina, pag ganon. No? So, I will also sum up the items for each level of learning and I'll put the answers at the last row. So, dito. Then have a grand total at the last column as well. So, dapat magtutugma yung total items dito and yung total items dito for the grand total. The total number of items for per level of learning represents construct validity kasi diba bawat components planong i-assess. Content validity is reflected by the last column, which refers to adequacy of the number of items per construct. These are the factors that could affect validity. Inadequate sample of the achievement to be achieved. So, that's affecting the construct validity of the assessment. Tasks that do not function as intended. Improper arrangement of tasks and unclear directions. Too few tasks for the types of interpretation to be made. Improper administration of the test, and judgmental scoring. So that's validity. Reliability, meanwhile, refers to the consistency of the results generated through multiple administration of the same test or administration of equivalent forms of a test. So the common method used to establish reliability is the test-retest method. In this process, we only have one test that is administered more than once. If the results are consistent throughout, then reliability is established. The other method is equivalent test method. Using a blueprint, two tests can be constructed. They are assumed to be equivalent because they are constructed from the same blueprint. Administering these equivalent tests and getting the same result or consistent results means reliability. However, not all assessments that are reliable are also valid. In describing validity and reliability, the classic diagram that we use is the board used for target shooting, wherein the innermost circle represents the learning outcome and the dots represent the assessment results. The first diagram shows an assessment method that is reliable but not valid. Reliable because the results are consistent in one area of the board but they are far from the center, signifying that the assessment is not valid. The second diagram depicts an assessment that has low validity and low reliability. Both qualities are low because the results are not in the center, but there is a tendency for consistency because the results are concentrated between the second and the third circles. The third diagram demonstrates an assessment that are not reliable and not valid, while the fourth diagram illustrates an assessment that are both reliable and valid. And this is what we desire. Reliability of assessment can be affected by unclear directions, insufficient time to take the test, presence of distractions, objectivity of the scoring, and variability among the examiners. Assessment should also be feasible in terms of time and resources, and it should have a positive impact on both teaching and learning. So we've mentioned that a couple of times already. Assessment tools that are usually used to assess skills or behavior are checklists, analytic grading rubric, and holistic grading rubric. So what's the difference between the two? Analytic is used when we want a judgment on each criterion by which the performance or product is to be judged. Holistic is based on an overall impression of the performance or product rather than a consideration of the individual elements. So let me show you examples for each. This is an example of a checklist. So the main task is local anesthetic injection. So it lists down the procedures. Now, checklists are typically used for direct observation of skills. Okay? And then the examiner will just have to tick or indicate if the steps are completed or not. So that's a checklist. This is an example of a analytic grading rubric. So as we can see here, there is standards for performance per criteria. So the first column indicates the criteria. For example, content and development, organization and structure, use of APA format, grammar, punctuation, and spelling. So these are the criteria, and this represents the constructs that compose an outcome. Okay? So for each of these criteria, there is a standards for performance, and then there is a scoring scale. Okay, so this is analytic grading rubric. Compared to a holistic grading rubric, where there is only an overall impression of the performance or product. So, for example, for exemplary, no, it lists down the standards. Ito yung mga standards para masabi na exemplary yung performance. For accomplished, ito. For beginning, ito. For unsafe, ito ang mga standards. So, hindi siya per criteria. So, as you can see dito sa grading rubric, holistic grading rubric, walang criteria na nakalagay. No? Yung kabuuan ng performance ang ina-assess with the use of holistic grading rubric. The last question is, where should the learner be assessed? Sa classroom ba? Online ba? Sa clinics? Sa simulation or laboratory? Sa hospital or sa community? In deciding where assessment will take place, there should be consideration in terms of feasibility and authenticity of the assessment, as well as potential use of technology. So there, we have discussed the assessment profile reflecting the trends in assessment and its use as a framework for planning assessment. We have also discussed the 6 questions to ask about assessment, touching on the different purposes and types of evaluation, the stakeholders who can conduct the assessment, areas of evaluation, Miller's pyramid of assessment, and qualities of good assessment methods and tools. We have further emphasized the OBE concept of constructive alignment and its principles of expanded opportunities, high expectations, and clarity of focus.